Alzheimer's disease is a neurological disorder. Alzheimer's disease is a progressive neurologic disorder that causes brain cells to die and the brain to shrink, atrophy. Alzheimer's disease is the most common cause of dementia, which is defined as a progressive decline in cognitive, behavioral, and social skills that impairs a person's ability to function independently. Alzheimer's disease affects approximately 5.8 million people in the United States aged 65 and up. 80% of those are 75 or older. Alzheimer's disease is estimated to affect 60 to 70% of the approximately 50 million people worldwide who have dementia. One of the early symptoms of Alzheimer's disease is forgetting recent events or conversations. As the disease progresses, memory loss and loss of ability to perform daily tasks occur. Medications may improve or slow the progression of symptoms temporarily. These treatments can sometimes help people with Alzheimer's disease maintain function and independence for a short period of time. Various programs and services are available to help people with Alzheimer's disease and their caregivers. There is no cure for Alzheimer's disease or treatment that alters the disease process in the brain. Complications from severe loss of brain function, such as dehydration, malnutrition, or infection, result in death in advanced stages of the disease. Signs and symptoms. Memory loss is the most common symptom of Alzheimer's disease. The inability to recall recent events or conversations is one of the early warning signs. Memory impairments worsen as the disease progresses, and other symptoms emerge. At first, a person suffering from Alzheimer's disease may be aware that they are having difficulty remembering things and organizing their thoughts. A family member or a close friend may be more likely to notice when the symptoms worsen. Alzheimer's disease-related brain changes cause increasing difficulty with remembering. Everyone has occasional memory lapses, but Alzheimer's disease memory loss persists and worsens, impairing ability to function at work or at home. Alzheimer's patients may have difficulty identifying objects, expressing thoughts, or participating in conversations. Reasoning and thinking. Alzheimer's disease impairs concentration and thinking, particularly when it comes to abstract concepts like numbers. Multitasking is especially difficult, and it may be difficult to manage finances, balance checkbooks, and pay bills on time. Eventually, someone with Alzheimer's may be unable to recognize and deal with numbers. Settling on decisions and choices. Alzheimer's makes a decrease in the capacity to settle on sensible choices and decisions in regular circumstances. For instance, an individual may settle on poor or strange decisions in friendly corporations or wear garments that are improper for the climate. It might be harder to react to ordinary issues, for example, food consumption in the oven or surprising driving circumstances. Arranging and performing natural errands. Once normal exercises that require successive advances, for example, arranging and preparing dinner or playing a most loved game, become a battle as the illness advances. Ultimately, individuals with cutting-edge Alzheimer's frequently fail to remember how to perform fundamental undertakings like dressing and washing. Changes in character and conduct. Cerebrum changes that happen in Alzheimer's sickness can influence temperaments and practices. Issues may incorporate the accompanying discouragement, aloofness, social withdrawal, emotional episodes, doubt in others, peevishness and forcefulness, changes in dozing propensities, meandering, loss of hindrances, dreams, for example, accepting something has been taken, saved abilities. Numerous significant abilities are saved for longer periods even while indications decline. Safeguarded abilities may incorporate perusing or tuning into books, recounting stories and thinking back, singing, tuning into music, moving, drawing, or doing makes. These abilities might be protected longer since they are constrained by parts of the cerebrum influenced later throughout the sickness. When to see a specialist. Various conditions, including treatable conditions, can bring about cognitive decline or other dementia indications. In the event that you are worried about your memory or other reasoning abilities, converse with your PCP for a careful appraisal and determination. In the event that you are worried about reasoning abilities you see in a relative or companion, talk about your interests and get some information about going together to a physical checkup. Causes. The specific reasons for Alzheimer's sickness aren't completely perceived. Be that as it may, at an essential level, mind proteins neglect to work regularly, which disturbs crafted synapses, neurons, and triggers a progression of poisonous occasions. Neurons are harmed, lose associations with one another, and in the end kick the bucket. Researchers accept that for the vast majority, Alzheimer's infection is brought about by a mix of hereditary, way of life, and ecological variables that influence the mind over the long run. Under 1% of the time, Alzheimer's is brought about by explicit hereditary changes that basically ensure an individual will foster the sickness. These uncommon events generally bring about sickness beginning in middle age. The harm frequently begins in the locale of the cerebrum that controls memory, yet the cycle starts a long time before the main side effects. The deficiency of neurons spreads in a fairly unsurprising example to different locales of the cerebrums. By the late phase of the infection, the mind has contracted altogether. Scientists attempting to comprehend the reason for Alzheimer's infection are centered around the part of two proteins. Plaques. Beta-amyloid is a part of a bigger protein. At the point when these sections bunch together, they seem to toxically affect neurons and disturb cell-to-cell correspondence. These groups structure bigger stores called amyloid plaques, which additionally incorporate other cell flotsam and jetsam. Tangles. Tau proteins have an influence on a neuron's inward help and transport framework to convey supplements and other fundamental materials. In Alzheimer's illness, tau proteins change shape and sort out themselves into structures called neurofibrillary tangles. The knot disturbs the vehicle framework and is harmful to cells. Risks factors. Age. Expanding age is the best realized danger factor for Alzheimer's infection. Alzheimer's isn't a piece of typical maturing, yet as you develop more established the probability of fostering Alzheimer's illness increases. One investigation, for instance, discovered that every year there were 4 new findings for each 1,000 individuals ages 65 to 74, 32 new conclusions for every 1,000 individuals ages 75 to 84, and 76 new determinations for each 1,000 individuals age 85 and more established. Family ancestry and hereditary qualities. Your danger of fostering Alzheimer's is fairly higher if a first-degree relative, your parent or kin, has the illness. Most hereditary components of Alzheimer's among families remain generally unexplained, and the hereditary variables are likely mind-boggling. One better comprehended hereditary factor is a type of apolipoprotein equality, APOE. A variety of the quality, APOE4, expands the danger of Alzheimer's illness. Around 25% to 30% of the populace conveys an APOE4 allele. However, not every person with this variety of the quality fosters the sickness. Researchers have recognized uncommon changes, transformations, in 3 qualities that practically ensure an individual who acquires one of them will foster Alzheimer's. In any case, these changes represent under 1% of individuals with Alzheimer's infection. Down disorder. Numerous individuals with Down condition foster Alzheimer's sickness. This is likely identified with having 3 duplicates of chromosome 21, and along these lines 3 duplicates of the quality for the protein that prompts the making of beta-amyloid. Signs and side effects of Alzheimer's will in general seem 10 to 20 years sooner in individuals with Down condition than they accomplish for everyone. Sex. There seems, by all accounts, to be little contrast in hazard among people. At the same time, by and large, there are more ladies with the illness since they for the most part live more than men. Gentle psychological impedance. Gentle intellectual impedance, MCI, is a decrease in memory or other reasoning abilities that is more noteworthy than typical for an individual's age, yet the decay doesn't keep an individual from working in friendly or workplaces. Individuals who have MCI have a huge danger of creating dementia. At the point when the essential MCI shortage is memory, the condition is bound to advance to dementia because of Alzheimer's infection. A determination of MCI supports a more prominent spotlight on sound way of life changes, creating procedures to compensate for cognitive decline and planning ordinary medical checkups to screen side effects. Head injury. Individuals who've had a serious head injury have a more serious danger of Alzheimer's illness. A few huge examinations tracked down that in individuals aged 50 years or more who had a horrendous mind injury, TBI, the danger of dementia and Alzheimer's illness expanded. The danger expansions in individuals with more serious and numerous TBIs. A few investigations demonstrate that the danger might be most prominent inside the initial ½ year to 2 years after the TBI. Air contamination. Studies in creatures have shown that air contamination particulates can speed degeneration of the sensory system. What's more, human examinations have discovered that air contamination openness, especially from traffic exhaust and copying wood, is related with a more prominent dementia hazard. Exorbitant liquor utilization. Drinking a lot of liquor has for some time been known to cause cerebrum changes. A few enormous investigations and audits found that liquor use problems were connected to an expanded danger of dementia, especially beginning-stage dementia. Helpless rest designs. Examination has shown that helpless rest designs, for example, trouble nodding off or staying unconscious, are related with an expanded danger of Alzheimer's illness. Way of life and heart well-being. Exploration has shown that similar danger factors related with coronary illness may likewise build the danger of Alzheimer's infection. These include absence of activity, corpulence, smoking or openness to used smoke, hypertension, elevated cholesterol, inadequately controlled sort 2 diabetes. These variables would all be able to be altered. Hence, changing way of life propensities can somewhat adjust your danger. For instance, standard exercise and a sound low-fat eating routine wealthy in foods grown from the ground are related with a diminished danger of fostering Alzheimer's illness. Deep-rooted learning and social commitment. Studies have discovered a relationship between long-lasting association in intellectually and socially invigorating exercises and a decreased danger of Alzheimer's illness. Low instruction levels, not exactly a secondary school training, give off an impression of being a danger factor for Alzheimer's illness. Intricacies. Memory and language misfortune, weakened judgment and other psychological changes brought about by Alzheimer's can confuse treatment for other ailments. An individual with Alzheimer's illness will most likely be unable to convey that the person in question is encountering torment. Clarify side effects of another disease. Follow a recommended treatment plan. Clarify medicine results. As Alzheimer's infection advances to its last stages, mind changes start to influence actual capacities, for example, gulping, equilibrium, and entrail and bladder control. These impacts can build weakness to extra-medical issues, for example, breathing in food or fluid into the lungs, desire, influenza, pneumonia and different contaminations, falls, cracks, bed sores, hunger or parchedness, blockage or looseness of the bowels, dental issues, for example, mouth bruises or tooth rot. Avoidance. Alzheimer's infection is certifiably not a preventable condition. Nonetheless, various way of life hazard factors for Alzheimer's can be altered. Proof recommends that adjustments of diet, exercise and propensities, steps to lessen the danger of cardiovascular illness, may likewise bring down your danger of fostering Alzheimer's sickness and different problems that reason dementia. Heart-sound way of life decisions that may decrease the danger of Alzheimer's incorporate the accompanying. Practicing routinely. Eating an eating regimen of new produce, solid oils and food sources low in soaked fat like a Mediterranean eating routine. Following treatment rules to oversee hypertension, diabetes and elevated cholesterol. Inquiring as to whether you smoke. Studies have shown that saved reasoning abilities sometime down the road and a decreased danger of Alzheimer's infection are related with partaking in get-togethers, perusing, moving, playing table games, making craftsmanship, playing an instrument, and other activities that require mental and social engagement.